Thank you so much for sticking around in the main hall here. At this time, I want to introduce NCoC's Research and Evaluation Director, Jeff Coates. He'll come up to the stage and share how we're thinking about the future of measuring civic health at NCoC. Jeff.
Thank you. Good morning. For nearly 20 years, our team at the National Conference on Citizenship have been dedicated to serving your communities, cities, states in the field of civic engagement and participation by maintaining a baseline measure, and that is the Civic Health Index. We are grateful to have a long-standing partner in this work, AmeriCorps, who have gathered and published data and insights about volunteering in civic life in America. This work has evolved over this time, but has provided a backbone to understanding a range of political engagement, a range of indicators around voting, volunteering, community and political engagement, voting, and social connectiveness. This backbone empowers communities to shine a light on both the strengths and successes in improving civic life and to identify areas where investments, policy, and action are needed to improve our society. We are incredibly proud of the ways in which this work has provided vital information for our dedicated partners. With over 200 local partners, we've been able to publish 99 Civic Health Index reports, covering a diverse collection of states, communities, and issues. Today, we would like to take a moment and thank them and give a big round of applause for the thousands of civic leaders, many of whom are in this room today, who have contributed to this effort. So thank you. This work culminates in what will be our 100th Civic Health Index report, and we're calling that CHI 100, that I'm pleased to preview for you today. Our partnerships with states and leaders have changed the way governments go about their work, inspired legislation, reintroduced civic education, redirected investments, and influenced national and local conversations about how to enhance civic life. In this report, we will begin by reflecting on some valuable examples of this impact. In Indiana and Florida, civic health data catalyzed significant educational policy changes. Both states used the findings to advocate for and implement mandatory civics in middle school. Indiana became one of just 7 states requiring full civic semester, demonstrating how data can drive concrete policy changes. Our work with veterans have helped shift an important narrative. The data showed that veterans aren't just service recipients. They're civic assets who vote, volunteer, and engage their communities at higher rates than non-volunteers. Organizations like Got Your Six and The Mission Continues have used this data to create programs that channel veterans' continued desire to be leaders. In Rhode Island, the Rhode Island Humanities Council took an innovative approach to combining civic health metrics with local voices. They combined this data with an independent civic health assessment that reached thousands of residents through bilingual displays and community events. This enabled the state to build on civic data to form a more comprehensive understanding of civic life through the eyes of Rhode Islanders themselves. Because of this unique approach to data and storytelling, their index received the 2023 Schwartz Prize from the Federation of State Humanities Council. In 2025, upcoming reports from Vermont and Oregon, who are pursuing their first CHIs, will be looking at further expanding the ways leaders and organizations can use this data to identify areas for investment and to advocate for policy changes. For our 100th report, we are pleased to have the newest data from AmeriCorps, which was released just a few weeks ago, to dig deep and identify trends that tell important stories about the way civic life is evolving. First, we're seeing significant changes in how we connect with our neighbors. In 2010, about 42% of Americans reported frequently talking with, are spending time with neighbors. Today, that number has fallen to 28%. You'll see that at the bottom line as well, those that talk or spend time with neighbors, not at all, is on the rise, a very challenging trend that demands deeper investigation. However, when we look deeper into the data, we find a powerful contrast. Rural communities consistently show stronger patterns of neighbor-to-neighbor engagement than urban areas, with rural individuals talking, spending more time with, and doing more favors for neighbors. One bright spot that caught our attention, we are all helping out our neighbors more. In 2023, it is estimated 3.2 million more Americans reported doing favors for their neighbors compared to 2017. Unfortunately, several areas show cause for concern. The data shows a declining trend in news consumption across all demographic groups, but with a sharper decline among the Latino communities. Since 2017, Latino men and women have experienced the steepest drops, 16.9% and 17.5% respectively, compared to the national average decline of 11.6%, highlighting a growing information gap that has real-world consequences on civic outcomes. We're also seeing political engagement evolving. While traditional forms of civic participation, like attending public meetings, are declining, we've seen a sharp rise in consumer activism. Since 2010, participation in boycotts have increased from 10 to nearly 18%, telling us that Americans aren't less engaged, they're just engaging differently. As you can see in these headlines, polarizing political issues are inspiring consumers to take action. From the Bud Light boycott covered by Vox, to the Goya food controversy reported by the BBC, to local coffee shop initiatives highlighted by the Daily Utah Chronicle. This form of civic engagement has become a powerful tool for Americans to express their values through purchasing decisions. When the National Conference on Citizenship started this work in 2006, we understood the importance of tracking how our civic landscape would change over time. Since then, technology has transformed how we connect, political engagement has taken new forms, and communities face new challenges that demand new approaches to measuring civic health. That's why we have begun the process of reimagining how to capture and analyze this data. Throughout 2024, we conducted in-depth listening sessions with nearly 40 civic leaders across the country. These conversations revealed something crucial. Civic health is transforming, and our ways of measurement need to do so as well. In every one of these conversations, it was clear that folks want and need more data. There is a need for a more holistic and representative picture of the forms civic engagement can take. And we need insights that are timely and have more detail at the local level. In order to truly evaluate the community's civic health, we need more investments, collaboration, and tools to understand civic health at a far more granular level. We also learned that there is value in developing a clear picture of what defines civic health. Leaders told us about new forms of engagement, from digital community building to consumer activism. They emphasized the need to measure not just what people do, but why they engage and why they don't engage in civic life. Whether it's isolation and loneliness levels in youth, or the disparities of broadband access and access to information, our community wants to dig deeper on the understanding of civic health. And there is no better place than to do it here at this conference with you all. With our ever-evolving civic health, we need our definition to evolve as well. We know this isn't the first, and it won't be the last time that we redefine civic health. With the help of our communities, we boiled it down into terms people can understand, while also being broad enough to capture all aspects of what makes up civic health. And here's where we landed. Civic health measures how effectively a community works together to promote the common good, address collective challenges, and improve the quality of life for all its members. These conversations and our past work have led us to pilot a new framework for developing indicators that can measure civic health. This framework is built on 4 essential pillars, the ingredients of civic life. And those are civic trust, civic knowledge, civic access, and civic action. Civic trust is at the core of how we need to think about the direction of civic health. We must develop a deeper understanding of the factors that influence confidence in our institutions and the connections between members of our communities. We hear every day that trust in most institutions is at an all-time low. And we share the recognition that we must increase that trust if we are to achieve greater social cohesion and decrease divisive and polarizing outcomes. We heard from all of you that we needed better tools to understand the components of civic trust. To address this challenge, we will explore and develop new indicators that provide greater insight into our trust and confidence in government at the local and national level, our trust and value for neighbors and leaders, and the ways in which trust varies across real diversity in our communities. Active and effective civic participation requires civic knowledge. Citizens must understand the fundamentals of civic education and maintain a concrete awareness of the critical issues and decisions facing communities. They must know how and where to participate, who holds power and why, and what resources are available to them to effect change. New and existing indicators will help us to measure the community-level understanding of how our democratic system works and the skills needed to participate effectively. In particular, we aim to see what we can learn from sources of civic knowledge, such as social media conversations and local news content, to measure what citizens know. Not all communities are created equal. When it comes to the resources and infrastructure available for them, by measuring civic access, we can highlight what foundations exist and which ones will still need to be built in order to serve citizens effectively. Key indicators that will inform our understanding of civic access will focus on information systems, civic services, availability of third spaces, and institutional transparency. By looking at everything from the accessibility of public meetings to broadband access and library capacity, we expect to reveal a more holistic picture of the shape of the functional civic landscape in communities. Ultimately, civic life in America must be examined through the lens of civic action, how people participate in their communities. These actions take many forms: advocacy, volunteering, voting, and demonstrations. Through these actions, citizens' voices are heard, accountability is upheld, and the belief that all individuals have the ability and responsibility to engage in societal issues to improve their communities. Many forms of civic engagement in everyday life are difficult to measure. However, those we do measure show that Americans reflect our nation's values and diverse society, despite the many barriers, access to resources, and institutional distrust. As we seek more indicators of civic action through various sources, we can tell a fuller picture of the states and communities we work in through the Civic Health Index. Each of these pillars help us understand not just what's happening in our communities, but why it's happening and what we can do about it. These pillars are interconnected, and in order to be civically healthy, you need to be strong within each one. And we need your help in shaping how to effectively measure each pillar. Some of that data is available, but some of that data we're going to have to work hard to acquire. Today marks the beginning of the process to improve our shared ability to understand how we can work together effectively and see more powerful outcomes going forward. We look forward to continuing this work with you to find ways to ensure the health of civic life in America is stronger tomorrow. For those interested, we're going to be diving deeper into this work at 4 p.m. today in Classroom A. We will be exploring questions around what metrics matter most to communities and how we could build better measurements together. Whether or not you're able to attend, I want to thank you for your civic engagement with this critical work. The future of civic health measurement will be shaped by conversations like these and partners like you. So thank you.